All right. So my name is Vanessa Brewer. I am the Regional Interagency Council Program Administrator. My co-host is Lee Taylor. Lee is the State Interagency Council Program Administrator, and we work with the Department for Behavioral Health, Developmental, and Intellectual Disabilities. We want to thank you for joining us today. Today's REACT Learning Series session focuses on continuous quality improvement, including the benefits of CQI processes, engaging in PDSA cycles, which is Plan, Do, Study, Act, and how to look for and create data to monitor desired outcomes. Jess Klauser is our presenter today. She is the evaluation manager with the University of Kentucky's Human Development Institute. And before I turn it over to Jess for her to introduce herself, I would like to go over just a few housekeeping items. So if you haven't already, please mute your mics. We do have time carved out later on in the session for questions and answers. And at that time, you are free to raise your hand or use the chat box for any questions or comments that you have. And Lee and I will be monitoring that. Also, the workshop will be recorded and posted on the REACT's YouTube channel, and we'll put that link in the chat box a little bit later. A session evaluation link will also be posted in the chat box towards the end of the session, so please take a moment to complete it at that time. It's really short. Those evaluations help us to plan for future sessions, so we really do appreciate and value your input. And as always, certificates of attendance are available by request, and you can email me if you'd like to have one, and I'll put my name and email in the chat box as well. So I'm going to go ahead and turn it over to Jess Klauser.
Great, thank you so much. Let me see if I can share my screen. So thank you again, and good morning, and welcome to this REACT Learning Series session focused on continuous quality improvement. So my name is Jess Klauser. I am Evaluation Manager, as Vanessa mentioned, at the Human Development Institute, and I've been in that role for about a year. And I serve as the PI for the evaluation of multiple projects that might sound familiar to this group, including the kind of outgoing SOC5 project, the incoming Kentucky 6 project. I work on AWARE 2 and AWARE 3 as it is getting kickstarted, Tailored 2.0, and other projects that might not be as relevant to this group. Before that, I worked in research at the University of Kentucky in the College of Medicine and Health Services Research. Before that, in public health research in the College of Public Health. And then prior to that, in the College of Social Work, all at the University of Kentucky. I've been in this realm for about 16 years. As part of my role with the evaluation unit at the Human Development Institute, we work with our partners on CQI cycles quite often. And this is more or less the use of data to monitor progress on an action plan. And so my understanding is that I'm coming to you to help provide some context and tools for how to employ CQI in your own action planning as you complete that really important work of building and fortifying a system of care for Kentucky's youth and families. So I was asked to provide this group with some background and information about tools that you can use to aid in that process. And then importantly, how you can use data to help you stay on track with your action planning. So you'll see a couple sayings on this slide that I did not make up, but that resonate with me. They might sound familiar to you too as well. You manage what you measure. You know, we do tend to manage the things that we measure. We give them our attention and our time. And measuring something gives it, therefore, an amount of importance. And so in order to manage the things that you treasure, it's a good idea to measure them. So I would implore you, as we go through today's session, to think about making what you measure in line with your goals and your values and what you want to accomplish in this important work. So some key goals for today's session include, first off, just providing a brief introduction to CQI in general, what it is and why it's beneficial. I think one way that is helpful to habituate yourself to using data as part of your implementation and progress monitoring is using tools that provide some guidance. And so PDSA cycles can be really helpful in this way to provide a framework and a planning tool that can help you break down some of your big goals into smaller chunks or interventions or activities that you can deploy at a smaller scale and then perform rapid tests of change on them to see if they're effective. So our second goal is to learn how to engage in PDSA cycles for these rapid tests of change. And then third, I hope to help demystify the use of data as part of your action planning. Sometimes even using the term data can sound intimidating because we might have ideas about whether we're data people or not. And I'd like to help you see how data can be your friend and can help you stay on track and work incrementally towards your big and important goals. So I'm curious, when you hear the term CQI, what comes to mind? Are there just some, does that bring to mind anything for folks? Feel free to put something in the chat. Well, I think a very basic way of thinking of continuous quality improvement or CQI processes is to create systems, structures, and an organization around asking these two questions. How are we doing? And can we do it better? So basically at their root, CQI processes are ways of just always thinking about improving. They're commonly used in healthcare environments to improve efficiencies and workflow, to enhance patient satisfaction, reduce costs or other outcomes. And that's where I became familiar with PDSA cycles, was in more of a healthcare environment. But really, I mean, CQI is used in myriad contexts. You might have standing CQI initiatives in your organizations already, and so you might have some familiarity with that. In the past system of care grant that we support, I say past, it's SOC5 that we're kind of wrapping up right now. We worked with our partners to identify certain data points that we wanted to review on a regular basis. And then we'd use meeting time to co-interpret the data, to determine if we were seeing gaps and troubleshooting ways to address these gaps. One example of data that we reviewed related to referral pathways. And so we would monitor the number of clients who progressed on to each step of that pathway, from screening to referral, to assessment, to services received, to follow-up services received. And by consistently reviewing these points of data and observing when we see big drop-offs or unexpected findings, we can talk as a team regarding the reasons why. Not with blame, but curiosity. And even just that process has power, asking, why are we seeing this? And there's a concept of 5 whys that maybe folks have heard about, where when you find something that's unexpected, you just keep asking why until you really start to uncover the root cause of the issue. Like, why are assessments not occurring? Our provider, well, why might they not be making it to the provider? Do they have the documentation required to complete the referral? Are clients opting in? Do staff know the procedures for including all the required documentation? All of these would elicit a different step to address the barrier and address the issue. So just asking these reasons why as a team can help. So that was a little bit about what CQI is, but why do we do it? I mean, apart from the obvious goal of striving for continuous improvement, we found that engaging in regular CQI meetings and processes, it really helps to align diverse members of a team toward their common goal. So when you create opportunities for asking how you're doing and how we can do better, you're by nature always coming back to your goal. So what does better mean for us and how can we achieve it? Having these sorts of processes in place just build the structure around documentation and using data to discover those opportunities for improvement. And when you have that structure built where you review data with partners and routinely ask about why you might be seeing the results you see, you learn more about your partner's systems and their processes and their barriers, which might be common with your own and they might be unique. They might be different from what you experience in your own agency and environment. And then relatedly, teams can work collaboratively on breaking down barriers that are uncovered through these processes. So we've talked a little bit about CQI, but I mentioned that we would specifically be talking about a CQI tool called PDSA cycles. So I'm curious at this point, what your comfort level with PDSA cycles are. So Vanessa, if you don't mind launching that poll, if you could please enter which one of these aligns most with your experience. So the first one, you already feel comfortable with PDSA cycles, maybe you've used them or are familiar with them. The second one, maybe you're familiar with PDSA and you're ready to consider it. Or three, maybe you've heard of them, but you'd like some more guidance before implementing. Or four, what does this even mean? Okay, we've got about 18 of 32. Anyone else want to throw in there? Right. Looks like.
We still have people participating.
Okay.
So maybe if we leave it open about 10 more seconds, we've got about 24 of 32 that have participated.
We'd really love for you to participate because this will help. It helps give a sense of where folks are. Right, I think we can move on. Is my screen still being shared?
Okay. It is. Can you see the results of the poll too?
I do, and do others as well. So it looks like about 46% are in a place of not being sure, and 27% haven't heard perhaps of a PDSA cycle before. All right, so we'll move on. So first I want to tell a little bit of a story. I was in a situation recently that's likely familiar to others on the call. So my daughter had a violin lesson across town about 30 minutes after I finished work. So on the first day, I wasn't familiar with this area yet. I didn't venture to this part of town all that much. So on the first day, I looked up the directions and I planned my route. I wanted to get there in the shortest amount of time. So I chose the route with the shortest distance according to Google Maps. That made sense to me. So as we ventured on our way, we got stuck in traffic. So sitting in multiple rounds of lights, it was 5 p.m. on New Circle Road. And I know not everyone is in Lexington, but if you have been there, then you know this is not a good place to be on New Circle Road at 5 p.m. So we just barely got there on time. So the next week, this was not satisfactory. So the next week I tried another route. This one was still through town, but avoided New Circle Road. I did my research. This route was a little bit longer, but I arrived on time, but it was close and there were a lot of traffic lights. And I could see where if luck was with me on one day and I hit all greens, I might be okay. But if I hit reds, I might not make it. So I wasn't satisfied. So the next week, I decided to test another route. So I went back to Google Maps and I found another one. This one was longer. It actually involved getting on a highway. But my other routes weren't good enough. I didn't like them. So I tried this one. So I documented again the time we left and the time we arrived. And this one got me there with time to spare. So I tried it again and it worked. And I tried it again and it worked. So can anyone guess what this is an example of? If you were thinking a PDSA cycle, then that's what I was thinking. I did several PDSA cycles. So as a brief description, PDSA stands for Plan, Do, Study, Act. The PDSA process is intended really for testing small scale changes. You conduct these small tests of change to build confidence in their efficacy prior to full implementation and scale, or to just test small tests of change that might be standalone. And how does my simple example map to it? Well, right from the beginning, I established my goal or objective. I needed to get to violin on time. It was concise, it was targeted. I decided in advance what success looked like. For me, arriving on time was success, but also 5 to 10 minutes early and having it be consistently a short period of time in the car. So I decided how I would measure it. Again, it was from the time I left to the time I arrived. So then I did it. I executed my first plan. I observed what happened. documented when I left and when I arrived. And then I reflected on it. I studied it. My main data point was, again, that departure, time of departure and time of arrival, and I wasn't satisfied. So then I had to act. So I made a conclusion about my preference. And I could either adopt my test of change and keep the route that I first tested, but I didn't want to do that. So I could adapt it, where I could change what I was going to test and then try the cycle again, or I could abandon it altogether. So I decided to adapt it. So then I went back to the planning phase. I researched a route. I tried another one. I went through another cycle. That was unsatisfactory. So I did it again. So I went through several small PDSA cycles to ultimately reach the route that was satisfactory for me. And I use this as an example, not to make light of the real planning and work that goes into action planning and continuous improvement that you all will make as part of your work. They're not comparable, really. But I use this as an example to remind us that we actually do this sort of thing all the time, and that the data that's appropriate for you to collect in any given context might take different forms. And I also want to make the point that while my immediate goal was to get my daughter to her lesson on time, that was not my overarching goal. My overarching goal here was about getting my daughter to participate in an activity that would help her build competency in a skill and confidence in herself. But for that to happen, she actually had to get to her lesson on time. And so this time, my PDSA cycles were about getting from point A to point B as fast as I could. Once that was conquered, then we can move our PDSA cycles onto getting her to practice at home or whatever the next relevant step is. And so you might engage in these informal PDSAs all the time. They don't have to be intimidating, but the more attentive you are and the more specific you are in what you're measuring and how, and the more engaged you are in the process, the more successful you'll be in finding a solution that's right for you. Also, just like to make that point of PDSA cycles are iterative mini experiments during which you'll find an area where you might want to see improvement. You'll make that plan, you'll carry out the change, you'll study the results. And then in this final step, act, that's where you decide regarding whether you adopt that change, adapt that change, or abandon it. And you want to make that decision based on the data that you've collected, just like I did with my commute. And again, as I mentioned before, you can use these for small initiatives that are standalone, but they can also serve as a means to break some of these big goals that you're trying to tackle as part of this work into smaller, more manageable chunks. Because ultimately, the outcomes that we really care about in this work, improve child and family well-being, improve behavioral health outcomes for children, youth, and transition age youth, these can be difficult to achieve and they're long-term. So we might need to find some small successes to make that incremental change. I also really do believe that when you begin to build these sorts of CQI processes into how you plan to accomplish smaller goals, you begin to build your own skills and comfort level with using CQI in general, because it becomes about that cycle. It becomes about the process. So going to become comfortable and familiar with the process. So now let's dive into what it actually is. How do you engage in a PDSA cycle? It's pretty heavy on the planning. And so in this plan phase, the first thing you want to do is build your team. And this process should be completed with your team. It doesn't need to be a solo journey. We are stronger and smarter together. One of the great assets that you have baked into your REACT structure is that you have some mandated roles within your REACT that can help round out some of the expertise and knowledge that's helpful with this planning. That being said, I think it's still helpful to consider how important it is to have the right people on your CQI team. So it's good to have that topical or content leader that has the expertise in how changes will affect the processes that you're trying to impact, and that can support engagement across organizations or agencies. It's good to have a technical expert, someone that has the deep knowledge of the process or an area of focus for improvement. And that might include more than one role. And this might be where you have someone with comfort with measurement and evaluation on the team, or CQI. It's good to have a day-to-day manager, someone who can lead the QI team, manages the work plan, and keep people accountable for their role. And then it's also important to have to be thinking about resources. So having a link to the QI team and senior management, someone who might have the ability to address capacity and resource needs for the project. So thinking about those ultimate objectives and your immediate goals and who are the power brokers, who knows this field and the technical issues related to it, who has control over resource allocation that might be required for sustained change testing. And then other considerations to include diversifying your team. Like, do you have a diversity of roles and perspectives? Have you engaged key influencers? Is there a champion who's committed to continuous improvement? And then have you engaged the target audience? So do you have individuals with lived experience or who represent your population of focus that you're engaging as part of this work?
So Jess, can I
Mhm.
I would like to pause for a minute back on your previous slide. And I have my CQI team here from DCBS. I'm Melinda, the field quality branch manager, and this is exactly why we're here today. We're diverse, having that diversity and collaboration with REAC. And the CQI specialists, of course, are experts in CQI. We also are looking at revamping our CQI training. I love some of your slides. I hope you can share some of those. But we are trying to get diversity right, and experts at the table, and CQI specialists is a part of that now with REAC. They bring data and their expertise around that. So I just wanted to interject that for a minute. And
I really appreciate you bringing that up because I had you actually in your team right there in mind with this technical expert category. I
yeah,
think that is a wonderful addition to some of the React. So thank
yes.
you for calling that out.
Yeah. And I can give a great example. One of the reacts was looking at food neglect. So they looked at DCBS on how many reports do you get around food neglect, right? And how can that help our action plan and our process, and looking at families and how we can provide resources and assistance. So we are very excited about this partnership.
Thank you so much. Thank you for being here and thank you for the comment. All right. So we'll move on to the next part of planning. So identifying the problem. So you likely have already articulated this through your action planning process, but identifying the problem to address is really the first step after building your team. And so I include this slide as a reminder that there are multiple pre-existing data sources that can be used to identify problems to target. And then also, as your implementation progresses, they can be used to monitor outcomes on an iterative basis. Please remember that you will likely not affect these outcomes through a single PDSA cycle, outcomes that are tracked through some of these surveillance systems. But as your work grows and builds, the hope is that your work will ultimately influence outcomes reflected in these data sets. And so it's nice to check back in with them to see what that is looking like. And remember that even many of the national data sets listed here have state or even regional data available that can be used for setting targets and monitoring results for individual reacts. So once you know the problem you want to tackle, we're still in planning, then you can set a goal for how you want to tackle it. Now, just as you want to identify a problem based on available data, it's ideal to have your aim statement that it has data in mind because you'll want to know when you'll achieve it, right? So this is where the SMART guidelines come into play. I'm curious if anyone, well, I'm sure you might be in a place where you haven't heard of SMART guidelines, but you might be tired of hearing about SMART guidelines at this point too. We might all be very familiar with them. In either case, though, putting the thought into checking each of these boxes while you're planning, it really does help to focus your efforts and what you want to accomplish. And it makes it easier to understand if you're ultimately successful. So you want them to be specific. So you try to prioritize your focus. Can you narrow down your focus to a specific need or a priority population most at need? You want it to be measurable. Again, using data or insights to guide your improvement processes. Data are your friends. Like, this is information that is systematically gathered to help you understand where you are in your journey and if it is working. It's how you're going to know if you are successful. Your aim should be actionable. If it's not, and if you don't have the resources to be able to tackle it, it might be important, but you still won't be able to complete your goals. So it's helpful to align your resources with needs. Should be relevant. So in line with what the population needs, thinking about what the greatest needs of your population of focus are. And if your aim statement isn't relevant to the problem you're trying to tackle, then again, you might be able to achieve it, but it doesn't get you anywhere you want to be. And then time bound. We do need to set some time parameters so that we can end our testing and see if we've accomplished something. I have some examples here that might be applicable to some of the work that you're doing. Increasing outreach to LGBTQ plus youth by 20% by 2024 or April 2024. See, some of these timeframes might be, you might even set an aim statement within a month of when you initiate your planning. A lot of it really depends on what your goal is and what you're trying to achieve. It could be something that's a year out. But these are some examples, but again, highly variable depending on the nature of your plan. Now, believe that this is also something that your teams have probably already undertaken. Still in the planning phase. So once you've worked with your team to decide on an issue to address and a SMART goal, then you'll need to decide on a test of change. So I'm including this diagram as another tool that can help you organize your thoughts and processes. This is called a driver diagram. It isn't required that you use a driver diagram. It's not always, it's not inherently a part of a PDSA cycle, but it can be used to help map out the relationship between the problem you're trying to address, the goals you've created for your team, the drivers at different levels, primary and secondary, that influence that goal, and then the change ideas that you can implement in order to affect change in those drivers and then ultimately meet your goal. So the driver diagram can also help you map out what you need to measure to document whether you've successfully tested an idea and then whether it met your definition of success. And because PDSA cycles can be used iteratively, you can map out multiple tests of change in one diagram so that when you've completed one and if you found it to be successful, you can come back here to determine what change idea you can target next. Or if you didn't find it to be successful, you can still come back to your driver diagram to determine how you might want to tweak it. I want to give the caveat, this is a tool where it can be easy to get hung up on levels and definitions. I've been in some pretty lengthy conversations about whether something's a primary or a secondary driver, and I would just say I wouldn't worry too much about that. I think the key here is just there are layers of influence, and you want to target something you can change. And this helps demonstrate that there are those multiple layers of influence. So again, I wouldn't get too wrapped up in that, but just recognizing that there are some of these problems that we're trying to attack have a lot of layers that can be targeted and that can be changed potentially. This final column, the measures, I do want to pause for just a moment on that while we're considering the data collection piece in our planning. So essentially, when we're trying to think about the measurable component, there are two main questions we want to answer. How will you know if you did the thing? And then how will you know if it worked? So we have a term for the question, how you answer, how you know you did the thing being the test of change. Those would be process measures. So this might sound blatantly obvious, but when we're making the decision at the end of a cycle about whether we adapt, adopt, or abandon our intervention or a test of change, it'll be important to know if we actually did the test the way we thought we were going to do it. So in my simple example with commuting earlier, if I was testing a route to my daughter's class and I decided to make a detour, or if I was forced into a detour, then I hadn't tested the route that I planned yet. So I couldn't evaluate whether or not it was a good route. Like the outcome is not tied to that route because I didn't take the route. So in order to make a conclusion about whether your test of change worked, you need to confirm that you implemented it as planned. So we call those things process measures. They will depend, what a process measure looks like will depend on what your test is, but some examples could be attendance logs or could be participant demographics, satisfaction surveys, numbers trained. Those can be quite variable. Now, in terms of knowing whether it worked, we call those outcome measures. Again, these will also be variable, but this is where you actually, for me, in my example, the outcome measure was the amount of time it took me to get to violin. And so you will determine that in advance, what success looks like, and we call those outcome measures. You can use pre-existing data. Again, it depends on what your test is and what you're trying to accomplish. Using pre-existing data when possible is great, because then you don't have to include processes for that. There might be student climate surveys that are being conducted, community assessments, risk factor surveys, but you might be in a place where you need to build your own. So you could conduct interviews or focus groups. You could conduct your own surveys. You could use polling as part of your meetings. The data you use will depend on what your test is, but if it's not available, then don't be afraid to build your own. So I'm going to walk through a hypothetical example that might feel familiar to you. So our team works with REACT leadership to help with its own CQI efforts related to sustaining involvement and engagement of parent or youth reps on REACTs. Now, my understanding is this sort of goal wouldn't align with the focus of your own action planning, but my hope is that by walking through this, you might have a sense of what it feels like to be part of a continuous quality improvement initiative using a PDSA tool, and how these tools could be a part of that initiative. I need to give the caveat, we didn't necessarily use PDSA cycles as part of this work, but this is how it could, that's how it could look if we mapped some of the problems that were trying to be tackled. So in this example, say the problem that we determined was sustaining the attendance and engagement of parent and youth representatives on REACTs, with a SMART goal of increasing parent attendance in REACT meetings by 20% by April 2024. So we work through what we believe some of the primary and secondary drivers could be, and we determined that one of the barriers that parents face to being involved in meetings is their time and schedule conflicts. And you'll see that that's in a kind of a maroon color. And maybe we work out that a secondary driver related to that is that these calls are occurring during the workday. Again, this is hypothetical. I don't think that they are right now. But then we might determine that our change idea then is simply to schedule meetings in the evenings. And we could actually have part of our test of change be that we poll parents to understand what their schedule desires are, what works best for them. Maybe evenings isn't what they want. Maybe it's lunch or weekends. But if we use that as our test of change, then we might decide to understand if we actually did the test of change, when did the meetings occur? Did we actually change the time of the meetings? Did we poll parents to determine what their preferred times were? And then our outcome could be how many parents were involved at baseline, how many attended meetings at baseline, and how many attended after we implemented that change. And we could look for that growth. Just one comment to make, I might make it again later, so forgive me if I get repetitive, but when you want to measure growth, you need to remember that you need to measure a baseline and after intervention measurement, you need a pre and a post. So that would take some foresight. Maybe we also look at other drivers that we think could be affecting that. And we've got a mainly rural dwelling population, and we determine that transportation barriers are an issue. So we decide that one attempt that we'll make to address that is create a Zoom or a call-in option. So a process measure to understand if that change took place could be, were the Zoom or call-in measure, or were the Zoom or call-in options offered? And then again, we could look at how many parents attended at baseline and how many attended after the change cycle. Now, once we've kind of mapped that out on our driver diagram to have a sense of what our test of change would be, we can apply our planning to a planning template. We are still in the planning phase. I want to give a big caveat here. There are multiple templates available for use. There are many organizations that have templates available to use. A couple of them that I've used are the Agency for Healthcare Research and Quality, the Institute for Healthcare Improvement, the National Implementation Research Network, but it doesn't end there. If you Google PDSA planning templates, you'll have options available to you. You might want something with more or less structure. Some focus an entire page on the planning piece, and some map out all of the steps in one page. So you might have a different desire for different tests of change. I just want you to know that there are many options available. These are a couple examples. I like this one for this purpose because it creates a place where you can include your measures. It also acknowledges that there might be multiple tasks and people involved in your process. It gives a lot of space for this planning section. And this is where you can really get into the weeds with planning. This is where the accountability can come in and where the team can mutually decide how you're going to know when the change is implemented, what success looks like, and what outcomes are predicted by the team. And this is also where you can acknowledge that those change ideas are constructed as several steps. Like as we just talked about, in order to change the time of the meeting, a step still might be to understand from parents what their desired meeting time is. So that's that can be a part of the test. But you have your team, you're not alone. Divvy up the tasks, define deadlines and responsibilities, and then check back in at your next meeting. And then down here at the bottom is where you get into the act of defining how you're going to know if the change occurred, so your process measures, and then how you're going to determine if the change was successful, so your outcome measures. And again, in our prior example, we're thinking about using process measures like, was the call offered? Did people join via Zoom? And if you're interested in testing the timing of the meeting, was it changed? Did the timing correspond with polling? And then again, if we're looking at growth, we need to count the number of parents that were involved at baseline and then after. If you're just looking for setting a certain goal of like getting X number of parents to participate at some point, you don't necessarily need the pre-post. So your data needs to match your goal. Some considerations. Again, remember that you can do many small iterative tests. The more things you combine together, the less you'll be able to isolate individual effects. So we walked through on that driver diagram, we had 2 tests of change that we identified. You could do them together, but you might not be able to pick apart the difference in the effects of one versus the other. So if you want to isolate and understand the effect of one test of change, then you might want to do that on its own. But the nature of PDSA cycles is it's good for testing those small incremental changes. So you might want to try one, see if it works, and then decide if you're going to adopt it, adapt it, or abandon it, and then move on to the next one. And remember, what you measure is what you're going to know. So it should be tied to what you want to change and what you want to learn. One comment is if you want to know participants' affiliations when you're assessing attendance, then you'll need to set up a way of capturing that. In that example for parents, if you're going to know if it's a parent or not by their name because they are the parent designee, then you might not need a way of capturing that information about them. But if there's some kind of characteristic of your attendees that you want to capture, and you're not going to know it just by seeing their name, you'll want to create a mechanism for doing that, whether it's a registration log, a survey, just, again, what you measure and set up a means to measure is what you're going to end up knowing. If your process outcome is engagement instead of just presence, then attendance logs won't be enough. So you'll need to decide how to measure that. Will you review meeting notes and count when key stakeholders contribute? Will you use polling in your meetings? Will you survey the group after the meeting to assess how engaged they felt or offer additional avenues for sharing ideas that can be tracked? Again, you'll need to match your measures to your goals and think about how to collect what you want to know. And so we're finally in like beyond the planning stage here. So this is the do phase. So this is where you carry out your tests. So each person assign their task. Optimally, we'll do it. In our example, you might reschedule the meetings for the evenings and provide that Zoom option. And this is where you collect the data identified in your plan phase for your process and your outcome measures. It's also helpful to just document your observations, including problems or unexpected findings. Describe what happened when you ran your test. Pay attention to any unexpected or unintended results that might arise from testing the change idea. Things don't always go the way that we expect them to. So that's also learnings. And that can be discussed with the team as part of the study phase. And then you do study. So you study and analyze your data, and you see how the outcomes compared to your predictions. So say that you noticed that parents attended, but they didn't seem as engaged. So maybe you reached your goal for attendance, but the engagement was also part of your problem. There was a time in one of my past positions, we were trying to figure out how to adjust to the pandemic. I was on a project where we were screening individuals for health-related social needs and then trying to match them with services in their communities that could help them. And during the pandemic, we'd switched from a clinic-based screening system to a telephonic screening system. So completely different. Now, ultimately, we wanted patients to opt into navigation services related to health-related social needs that they might have, if they screen positive for them. But to get there, we needed people to opt into screening. And to get there, we needed people to talk to us long enough to ask about screening. And to get there, we needed people to answer their phone. So we had PDSA cycles where we were tracking calls made, pickups, screenings, and navigations. And we tracked things like time of day and day of the week that calls were made. Now, when talking to our screeners, we had some exciting initial insights regarding a higher proportion of calls answered during the weekends that caused us to want to test this as a test of change. But when studying our results, we looked at our pickup rates, and then we also looked at the rates of calls that converted to screening. So when someone picked up, how many of those actually resulted in a screening, which was ultimately what we wanted. And we found that even though more people picked up on weekends, fewer agreed to the screenings, few enough that it was still more successful to complete our calls during the week, even though proportionally fewer people answered the phone. So this insight influenced our planning and was based on the data that we collected. And importantly, it also deviated a little bit from the insight we gleaned just from talking to our screeners initially, because they were so excited about those pickups that they were actually talking to people more frequently. But ultimately, when we saw that that wasn't converting into screenings, then it changed some of our methods. So then when we get to the ACT phase of the PDSA cycle, we need to decide the following: whether we adopt, adapt, or abandon. So adopting, again, would be selecting the changes to test maybe on a larger scale, or maybe you just continue to implement what it is you tested. To adapt, you modify the change, and you might continue to test. And you want to base those changes on your data that you've collected. Or maybe you would just abandon it. You discard the change idea completely and try a totally new one. In this case, you'd go back to your driver diagram to select a new change idea that you believe will relate to primary, secondary drivers. So let's come back here. So maybe you come back here and you look at your problem and you see that the engagement piece hasn't been solved. So you create a new SMART goal to address it. And you work through new suspected drivers based on data or the experience of members on your team. And you plan a new change idea to test. And again, I want to note that this diagram is inspired by work done by REACT leadership to engage parent and youth representatives, although their process didn't necessarily take this form. But I wanted to map out how it could look so that, because you might have been involved in some of this work, whether you realized it was part of a CQI process. The change ideas listed here correspond with materials and engagement ideas that REACT leadership has tested with members. And we work with them to regularly survey parent and youth reps, where we collect data on how stressed they feel during meetings and just overall attendance and engagement in REACT opportunities. And based on our survey results, they've tweaked the supports they provide. So funding has been secured to support REACT youth representatives on regional youth councils. They've incorporated REACT youth and parent representative supporters on REACTs and have created REACT, SEAC, and LEAC youth guidance documents. And so each of those actions can be assessed like a test of change and measured. You can look at parent-youth engagement beforehand and after, or their satisfaction or their level of stress associated with meetings, or you can look at participation in meetings. And because we capture that information at regular intervals, we can look at how different tactics or change ideas might influence parent youth engagement. And again, using this example, you would just take the information gleaned through this process and work through another change cycle. Once you have a success, you can take it and build on it. And you can rinse and repeat. So in summary, CQI is a useful process and a mindset really to help us strive to make steady progress toward improving our processes and accomplishing our goals. And PDSA cycles are one CQI tool that you can use to test ideas and interventions and to break some of these big goals into more manageable chunks. It can also help create a mechanism for you to use data to monitor your progress. And then remember, data is your friend and your guide, and measuring items that are meaningful to your goal and process will be most beneficial in helping you make the progress you desire. So if we could, I'd love another quick poll. Now that we've kind of walked through a little bit about PDSA cycles, I'd love to have just this follow-up question where you let me know what your comfort level is. Do you feel you're in a place to sign me up, ready to begin? You're ready to consider applying PDSA cycles? Maybe you're not sure still, but you feel like you've got a little bit more information than you did before? Or are you still in a place where you're wondering just what a PDSA cycle is? And as you're logging this, I'm looking at these results and they're making me pretty happy. And this is something that is that you can use too. Like this is a form of data, like the evaluations that you use as part of your own processes. This gives me information and feedback in terms of if this was a helpful presentation or if I just totally missed the mark in terms of the type of information that would be helpful to provide. So it's really encouraging to see that now of the participants so far, about 46% feel like you're ready to begin, and that 42% feel that you're ready to consider it. Whereas at the beginning, I think we ended at about 44% feeling not sure, and maybe 25 or so were like not sure what a PDSA cycle was. So this is encouraging. And we can leave the poll open if you want, or maybe it's just been closed, but I want to give a little bit of space if we've got questions.
And you are free to come off of mute and ask any questions you might have. You are also welcome to put them in the chat box as well.
And while folks might be thinking about that, I also want to say our hope and goal actually is to create some breakout rooms so that folks have a chance to talk in a smaller group about how they might see tests of change being applicable to some of your aims and how you might go about measuring things. So if time allows, and we'd love for people to have that opportunity to talk with your peers, and then we can come back together. And if questions arise during that time, we can have another opportunity at the end.
So I'm going to put the questions in the breakout room.
Okay.
Oh, Jess, I don't know if you just saw a question in the chat box that said, can more examples be given from the DCBS information as it relates to how to utilize that information with the PDSA cycle?
And more, I'm not sure that Michelle, would you mind, would you be able to come off and describe the question a little bit more?
Yeah, so the DCBS they used to give us like sheets that were distributed to us, and we would use that data, like say, for example, how many abuse calls that they got, how many neglect calls they got, how many of those calls turned over into actual substantiated cases, how many of those substantiated cases maybe had substance abuse as a contributing factor. So like we would then take those the data from those points to then kind of look at what was a high need in our particular area to be able to focus on and then implement that maybe like in a strategy on an action plan. So now that we don't get those, we're like just asking them specifically for maybe data that would be relevant to like our particular areas. How would you take that information that's on those fact sheets to then implement into this? Like I get it from like an action plan standpoint, but like what kind of like data then would we be asking for then to kind of then assess and analyze and then utilize this type of strategy? Does that make any more sense? Or would you have to kind of know, I guess, what the fact sheets look like?
I'm not sure that I can give you a good answer at this point with that kind of information, but I think that's where getting your team together and working through what you want, what an actionable goal would look like and what kind of data you need to address that goal, because it might vary depending on specifically what you want to target. And thinking about the data that you have available to you is an important part of that process, because it's obviously easier to monitor change on an ongoing basis if you've got steady access to data. But I think that would be a great question actually in a smaller group where you can work through like what a test of change would look like related to that. Because I think that would probably require some further discussion. That's actually the kind of thing that I was really hoping that in the breakout sessions, you guys could talk through, because I'm sure a lot of you are in the same place where you've got some of the same data points you're trying to look at, and you've got some of the same problems that you're trying to tackle. It might look a little bit different in one region to another, but maybe we can spend some time in the breakouts and then come back together and see if there's any insights.
Are we ready to go to breakout rooms? Okay, I'm gonna open them up and you'll be randomly assigned to one. And we're just gonna spend about 10 minutes in there and then we're gonna come back together.